Hi, my name is Elssy Rosales, and I am a social worker with the Pediatric Complex Care Program at Mount Sinai Hospital, and I use TelePlay to support my patients who are non-ambulatory and are living at home with complex medical conditions. A number of things that I think TelePlay brings to a hospital setting that are beneficial. The main one for me is a lot of my patients are non-ambulatory, and so it is challenging for them to come into a clinic setting and be part of an event. You know, they're on ventilators, they're G-tube fed, and so they're having a number of therapies at home. So it's really difficult to bring them out of the home setting and bring them to a hospital setting for an event. A lot of them have PICU settings at home, so it is very much like TelePlay is meeting them at home when they're getting their medical care at home in their own comfort. So I think that's such a great benefit of TelePlay, and also there's a lot of flexibility around it. There's a lot of flexibility around the programming and who can participate. If siblings are home, they can jump in and participate as well, or events can be solely around the siblings. So I really appreciate the flexibility with my population and the flexibility around who can participate in meeting the families at home. A patient story that really stands out is not necessarily one that I can pinpoint to a specific patient. What's been interesting is that they've had this universal experience of all being eager to participate in something that brings community into their home with other families who have similar experiences to them, of having a medically complex child at home who can't participate in typical parties, and their sibling who's eager to do something that partners with their sibling who they love so much but is also meeting their own need at home. Volunteers of Project Sunshine have been incredibly supportive in meeting the needs of our program population, of our patient population, and bringing in their own expertise around child development and what things can be done in a virtual setting. Vetting and training volunteers is at the core of why the program is so successful. I think the volunteers have a heart to meet the patients and support their families, and have a sensitivity to what kind of needs or what kind of situations they're meeting families in. And I think that's incredibly important. Not only do we recognize that volunteers have an interest in meeting this population as staff here in the hospital, but the parents recognize it as well. And the children can spot it in a second. They know who's interested in participating with them, and they know who's invested in them having a great time during each TelePlay visit. I would certainly recommend TelePlay to other hospital settings for many reasons. One of the reasons is because we are a medical institution and we're very focused on providing the appropriate medical support to our patients, and typically that's here in clinic or meeting them on the inpatient unit. So we don't always have the access or the availability to meet them and provide this additional support through things like TelePlay and different events.